Well, we're very excited to be here today. Like I said, my name is Nathalie van Haaren. We want to share a little bit more about who we are and what our mission is at FLEI. So I'm going to give it over to Emily to do the introduction, and just that we know where we are.
Good morning, good evening, or good afternoon, wherever you are. So Institute FLEI is a Feminine Leadership Evolution Institute, and it's a women-led, community-based educational platform that helps women in perimenopause and menopause develop effective work and life strategies based on our biology, psychology, and physiology. We support women to understand our hormonal journey and find sustainable way to thrive both personally and professionally. So Natalie, back to you.
Yeah. So how this hour is going to work, we have together 60 minutes today. It's going to be a conversational style format. So we've prepared questions for Natalie that either came from you or that we know are questions that a lot of women have around perimenopause. We would love it if you guys are active in the chat with questions so that we can make sure that we cover those. And in the last 10 minutes of today, we're going to ask these to Natalie. So that's a little bit of the format and how these sessions go. And without further ado, I want to bring Natalie to the stage or to the center of my screen. And welcome, Natalie. I'm going to give you a little introduction. Everyone, this is Natalie Roost. She's a Dutch physician, certified coach, and expert in mind-body medicine, and she has over 20 years of experience already in women's health, bringing together clinical science, nervous system regulation, which we're going to be talking a lot about today, and holistic coaching to help women navigate stress, and hormonal transitions like perimenopause, like we're going to cover today. She has a background in elderly care and functional medicine, and today she supports many women like us, in finding balance and reconnecting with their bodies and building resilience from the inside out. And outside of her clinical work, she's also a passionate photographer, a practice she describes as a form of mindfulness and way to recharge. Natalie, we're so excited to have you.
Thank you. Thank you very much. And thanks for this lovely introduction. Yeah, great. Great to be here.
I think we're going to kick off straight away. So I have my first question for you. You moved from being a practicing physician in elderly care to now coaching women through hormonal shifts and major life transitions. And I'm very curious, what drove you to move into this direction?
It's been a long, long journey to get here. I think 20 years of experience is a bit too much, but I've been a doctor now for almost 8 years. And, you know, we're trained in a very regular system, and you get to choose something in this system. And I really tried my very best to fit in this system, but felt already during my studies that I was missing something. And that was really to connect to the person in the entire person, and not just what are your symptoms, let's treat your symptoms. Here's some tablet or a capsule or, you know, a quick fix, really. But that was the only way to go, really. And I tried to find something. I think the elderly care was the most holistic approach that I could find, because, you know, people are in the end of their lives, and all that matters for them is just enjoy a peaceful end of their life. But in the end, I was still managing blood pressure, you know, fixing things that I was like, is this really important at the end of your life? All they want is just play bingo, fun, or and, you know, have a peaceful time. So it really wasn't fulfilling to me at all. I did my very best, and I didn't know. I actually thought I had to quit because I didn't fit in, and I almost did. You know it because I found you, Natalie, and you helped me a little bit on this journey. But then I found a whole different way of doing medicine, which is functional medicine or integrative medicine, which does allow me to look at a person in a whole. And I think women are deserving a holistic approach more than anyone. We cannot really focus one thing on a woman. It's so much. We have so much to focus on. I focused a lot on coaching first, but then I was really missing my part of being a doctor. And then finally I went on I did a mind-body training. So that really got me into my own body and really listening to what I needed and what I wanted to do, what I wanted to be like as a person, but also as a clinician. And that brought me here. Just it took me 4 years to get here, and finally finally doing this. And now the problem is huge. And I think we're just, as women, we're not getting the treatment that we should get. There's so much misunderstanding. We don't know where to go. Many clinicians, they tell you like, yeah, it's not your hormones, your burnout, you're too young to have these symptoms, or rest a little bit, do some yoga, meditate. And sometimes that's just not it. And I decided to go full in and learn all about it. And I'm still learning a lot, because there is a lot also not yet being researched, or we just know a little bit, bits and pieces. But yeah, I think, we really deserve an integrative approach as a woman, and I'm on it. Yeah. So that's a little bit about
Thank
my
you for
journey.
sharing that. And I think with you, many other women, right, that I've seen that there is a serious lack of knowledge and ways to support women in what you say in a very holistic way. And as you describing your own journey as well, it's not from one day to the next that we have all of this knowledge and that we can embody this knowledge. But I'm hearing you say it's actually a journey to go on as well.
Yeah. Yes. A long journey. Yeah.
Yeah. And that kind of brings me to the second question. I think that as women, we already go through so many stages and journeys. If we just look at like going from puberty to then going to your reproductive years, pregnancy, perimenopause, menopause, it's like we are born into this very cyclical way of being. And you already mentioned it, like hormones, it's a piece of the puzzle. But can you take us on how hormones evolve across these phases and how this kind of shifts the way we deal with life, the way we deal with stress?
Yeah, I think it's a great question. I think we are very cyclical people. We cannot really live in a straight line like men, for example. But when we enter puberty, of course, our hormones start to play a role. I like to see it as an orchestra, right? So when you're in puberty, you have this new orchestra with a conductor, and this conductor actually has no idea what it's doing, and neither does the whole orchestra. So it's there, it's like a new band. We need to play new music, but we have no idea how to play. But let's just do it. That's puberty. Also, your hormones, they just go one day. They're here, then they hear, then they hear. The violin is off, and then the drums are off, and you hear a ping here and a ping there, and nobody really knows what it's doing. But at some time, that's also why in puberty. Well, I don't want to say you're off. You know what I mean? It's just you're not stable, right? You're not in balance. You're not in sync. It can go every way, and some are more affected by it than others. But at some point it starts to play in sync, and it sounds nice, and you are a stable couple of years for sure, and you feel great, right? You feel hot and sexy, and you can really handle life well. Maybe at one point they're ready for a pregnancy, and then all the hormones are completely different again. And they're actually, estrogen levels are super high, progesterone levels are super high, and actually you are super stable in this phase. That's also why some women describe their pregnancy as the best time of their lives, because they're they can be on top of the world. They can feel very powerful. Where they felt insecure about certain things in pregnancy, they can just feel like they can do anything, right? They feel super powerful just because your hormones are really up, and they are serving you, plus they're in balance, right? And then you have the perimenopause, where sometimes people, they compare it to puberty, because you go back to this orchestra that goes out of sync again. Maybe the conductor has gone on a holiday for a while and then comes back and then goes away again, and then the hormones again go up and down. It's super fluctuating. That's also why we prefer not to test too much of the hormones in that period of perimenopause, because one day it can be high, the next day it can be super low. But you can imagine that these fluctuations really affect how you feel, right? Because you would like a stable face at all times, but that's not the case. Only after menopause, after that, because menopause is really just one day in the end. The time that you feel off is really the whole period of perimenopause. So of the fluctuations, and menopause is just one single day that you only know 1 year after when that day was. You never really know when that day was, but it's and then you're postmenopausal and all your hormones are just at a very low level but stable, right? So you feel okay. So this fluctuations, it's also temporarily, which is good, which gives hope. But until that time, it's chaos, right? Yeah. And then postmenopausal, your hormones are just super low. Like, well, I don't want to say like when you were 8, because it's a different stage, but you start with low hormones and you end with low hormones. That's basically what happens. And in between, it's from chaos to super nice to maybe even nicer to chaos again, too low. Yeah.
Wow, what a roller coaster if you just explain it like that. And I'm curious, just also for the people who are in the audience, can you share with us what you recognize? Like, are you in a period of, maybe just share if you're in a period of chaos or you're in a period of feeling stable, just to get a sense of like what we have in the room. That would be great. I know that personally I'm in chaos. So I'm very curious what kind of solutions we're going to be talking about. So Marianne as well, she's in chaos too. Okay, great. And
I'm in chaos.
Chaos.
I'll admit.
Okay.
Yeah, but learning how to handle these situations. Yeah.
One step at a time.
Nathalie, I absolutely love your analogy with orchestra because it is as orchestra and we are as conductors are constantly learning what is happening and how we can orchestrate things. And so I want to ask you about some of the symptoms some of the really frustrating symptoms, and that's when our mood fluctuates, or one day we feel this and another day we feel that, and then we can't really focus because of the brain fog and we don't know when it goes away. So as you were talking about hormones, maybe you can also connect the hormones and our brain function, because I know that they are connected, but normally we only talk about hormones.
Yes. So yeah, I think we talk about hormones as reproductive hormones, right? But in the end, they do a lot more than just reproduction. And that's why you can really say that maybe estrogen is the conductor of this orchestra. It's a super important hormone, especially also in the brain. It has multiple functions. Cannot even quote them all for you, but besides being a reproductive hormone, it has a very important function on the brain. For example, I don't know, do you all know, or maybe you don't, but Lisa Mosconi, she's a neuroscientist, and she's done a lot of research on what's going on in the women's brain. Actually, there has not been done a lot of research on the women's brain, but she's done great research. I would really recommend The Menopause Brain. It's a book. What's her name? Her name is Lisa Mosconi. Mm-hmm. And she wrote a book on the menopause brain. I really recommend reading it because it's great, because it makes you understand what is going on in your brain, and you're not crazy, because it's actually a thing, because besides being a reproductive hormone, it also is a very important hormone for making serotonin, but also dopamine, acetylcholine, and these are neurotransmitters important for your mood. So you can imagine that when perimenopause it starts and your estrogen levels start to drop, it also has a huge effect on your serotonin levels, your dopamine levels. You need those to feel happy. These are your happy hormones. So you can imagine when it drops, your mood is also off. And on the other hand, it's also a very important hormone for some glucose transporters in your brain. And these actually provide your brain for energy. You need energy. Not only your body needs energy, but your brain needs energy to be able to function, right? So when these estrogen levels, they drop, these glucose transporters, they decline as well. What happens is that your brain, please tell me if it's going too fast. I hope everyone understands what I'm saying. But if the glucose declines, this is also what happens when you don't eat for a long time. Your body starts to make ketones to get energy, and this actually also happens in your brain. So when the glucose drops, your brain starts to make ketones to be able to still function and get some energy, but it's not a very efficient way of having energy in your brain. So she actually showed some PET scans, which you can show the glucose activity in your brain, and she actually showed that it's 30% less in postmenopausal women compared to premenopause. So this really explains like, brain fog is real. Imagine you have to function with 30% less energy every day just because your estrogen is so low and it cannot transport some energy to your brain. I mean, you're not crazy. This is real, and it's actually shown. And then when menopause is passed, the brain also goes back to a normal brain. Even the white matter declines in your brain. So we have to deal with a complete different brain during menopause than when we are past it or before it. So pregnancy changes your brain, perimenopause changes your brain. Only after that you stabilize again. But it's real, and it has been shown and proved. Yeah.
I mean, it certainly feels real.
Yeah, you don't even need the explanation to know that it's real, but it's nice when it, the research actually tells you that this is going on.
Yeah, and it's not just you, and you're not going crazy, but there is a research supporting that. I want to ask you about sleep, because 60 to 70% of women in perimenopause report sleep interruptions in sleep. And it's like a big underlying condition, because when you don't get enough sleep, you don't get enough energy.
Yeah.
When you don't get enough energy, you also have this brain fog that kind of multiplies, that feels more present, because you consistently don't have enough sleep. So if you can address this sleep issue and the hormonal changes maybe the significance. Can you hear me? Can you?
Yeah, I think it was a bit unstable, but I can
Unstable. Okay.
hear you again. Or is it me? Is it me?
No, you're fine. Yeah. So if you can connect this, or explain this connection between sleep in particular and our hormonal fluctuations.
I think that the hormone that's most responsible for sleep is progesterone. Also, the progesterone drops during perimenopause, or it goes up and down every, it's all over the place, but particularly it also becomes lower in perimenopause. And this is the Zen hormone. So it kind of stimulates the GABA receptors in your body, which is the brake of your body. But also, you need, the progesterone makes you sleepy and makes you fall asleep. So when it's off, it doesn't help. I'm sure there are more mechanisms than just progesterone that when it comes to sleep, because you're also more stressed in this period. I think it's harder to relax, when you're feeling grumpy or not at ease or all these things, it's harder to fall asleep or to stay asleep. But I think the progesterone is really the first thing that we supply, yes. So give back when women are saying, I have trouble sleeping. Yeah. And very often the sleep is restored by just giving a little bit of progesterone back to the body. That really helps. Yeah.
And I know that we thought about talking about hormonal replacement therapy, and progesterone is a part of that.
Yes.
So maybe you can mention this. And also there is a difference, because before people were using synthetic therapy, and now it's hormones. So maybe, you can mention that as well.
Yeah, so you're referring to the 2002 Health Initiative study, right? Yeah, I'm not sure if everyone is familiar with that study, but the whole reason why 20 years later we're not really getting the treatment that we're supposed to get in this period of our lives is because there was a study in 2002 initiated by the Women's Health Initiative, and it was stopped abruptly because it was shown that women in that study were having a higher risk of breast cancer. But actually, we now know in hindsight, and we actually have known it for a couple of years, but just the results of that study are still echoing 20 years later. Because I'm not sure, maybe around in your surroundings or maybe even yourself, when you think of hormone therapy, very often people say, I don't want that because I don't want to get breast cancer, or I don't want to get cancer, period. So they don't want to touch any of the hormone therapy because of that study, which was false in the end. It was tested on women aged over 63 on average. That's 1 point. Women aged over 63 years old, they already have a higher incidence or a higher risk of getting breast cancer in their lives. They're not 40, they're already older. So that was they're mostly postmenopausal rather than perimenopausal. And then the study was done with synthetic estrogen, which is the same estrogens that are used in the oral the birth control pill. Yeah, it's the same. So it's not bioidentical. I don't know if everyone is aware of the term bioidentical, but it's a synthetic, so it's made in a fabric. It's not your own. It does not look like your own hormone, right? So it's made. It's not, your body doesn't really. It also puts your whole brain down, basically, because your brain stops thinking, and the pill takes over your whole axis of the hormone balance, rather than your own brain regulating that. So it was based on synthetic hormones in older women, and it was not even an absolute risk. When we do research, when you speak of breast cancer, it was not an absolute risk. So it was not like, when you take this, there is an absolute risk of getting breast cancer. It was more of a relative risk. So when you would translate it to an absolute risk, I think it was about 0.01. There's a super good podcast on this. I think, and I don't know if it was recently, but it's with Rachel Rubin and Peter Attia. I also really recommend listening to it. It's super nice. She really gives a great insight on what was going on in that study. What was so wrong about this study, because it was not on the bioidentical HRT, and it should have never been thrown into the world like this, scaring everyone of getting breast cancer or thrombosis or risk of stroke. All of that is really not the case. And it actually, when you speak of bioidentical estrogens and bioidentical progesterone, it actually protects your brain, it protects your heart, it protects your bones. You need those hormones. So you can imagine that we live longer. So I think the mean age of a woman is 83 or something like this. And 1/3 of our lives we actually live without the hormones that we need so much to protect ourselves. So really you could see it more of a preventative treatment, that every woman should at least have the option to take it and be aware of what it can do for your health. It's, and the risks of the breast cancer, it's just not there. Not of stroke, not of thrombosis, not of heart disease. It actually protects your health. I don't have any assets in these hormone therapy, but I think every woman should really have the option of taking it rather early than later. Yeah.
And that's such a good point, Natalie. So when you define early, would that be with the onset of the symptoms or a little bit later? Yeah.
Research has shown that when you start on time, which really means as soon as you start having symptoms, there's a very good resource that you can use to check your symptoms. It's called the Green Climacteric Scale. You can just Google it and enter your, it has a checklist. You can score it from 0 to 3. It gives us a score. I think 0 to 15 is nothing, 15 to 30 is moderate, and above 30, I think, is severe. And I think when you're already in a moderate range of this Green Climacteric Scale, that is a very good time to start. You don't have to wait. I think we're still in the phase where we wait too long, where it gets super bad. You don't have to wait till you feel awful. It's better, even when you don't have any symptoms at all, I would actually still recommend of using it just for your own health when you are reaching the age of 80, hopefully. Then when I think back of it, actually, I worked in elderly care, right? So I was in Holland, we have these nursing homes. We don't have our parents at home. They live somewhere else, and I worked there for a long time. I think 90% were women. 90% of these women were demented. 90% of or all of these women were demented where I worked. They had very often they had urinary tract what's it called, infections. Yes, estrogen also protects your bladder. It also protects your sometimes, don't know these words, sorry, it protects the blaasontstekingen. the urinary. So
Mhm.
you need, it kind of protects your vaginal environment. So my point was that these older women, they always had infections. They all were very demented. They were having heart diseases. And this is a whole generation that never got to HRT because we kind of skipped a whole generation. And I'm really wondering that what would happen if we were treating ourselves right now? Would we end up this same way? Can we prevent maybe all these diseases that these women were suffering from? And nobody in that home was telling me, I'm having such a good life. They always were telling me, like, I want to die. I don't like my life anymore. So it's not because of hormones, of course, everything, but I think a lot of the diseases of women can be a lot less if we treat ourselves properly right now at this age of this period of time.
Thank you so much. And we have a question from the audience. Is it possible and wise to take hormone replacement therapy at the age of 63?
It depends on whether you're postmenopausal already. I think you are. And sometimes, again, on this particular question, is a very good question. There's not enough research that supports risks or that has investigated the risks, but there are definitely experts saying that if your quality of life is so low because you're still experiencing hot flashes, or you have stiffness in your joints, or if you're experiencing a low quality of life, there are experts saying just try. But there's also a bit of evidence that when you start HRT postmenopausal, that your risks of getting, for example, breast cancer can be a little bit higher. But yeah, in the end, what's more important, the quality of life or maybe that tiny risk that you're taking and you never know if you're actually getting it? So I think that's also always something to discuss with your clinician, and also being aware of your risks. And it's also up to you and your own, what you want. And if you want to take that risk. So it's a bit of an informed consent together, I think. But there's not really enough research saying, right now they all say no, but it's shifting a little bit. So there are really movements saying maybe you should just try if your quality of life is declining so much because of the symptoms, and just give it a try. Let's see what happens. But just to add, the receptors in your body for estrogen and progesterone, for example, they are already very low. So your body doesn't really, when you give it back, your body maybe doesn't really know what to do with those hormones anymore. So it might be very overwhelming and your symptoms can actually get worse. So that's right now why we're saying don't.
Yeah, thank you, Natalie. And it's so true. We're so behind on research that sometimes we are researching and understanding things as we go along. But also you mentioned, because there is no one formula that fits all, because in HRT, you really need a physician who understands the hormonal replacement therapy, because there is a different dosage that is being prescribed, like different dosage based on your symptoms of progesterone, different dosage of estrogen, and also testosterone. And so just, because we as women also need testosterone as well.
Yeah, definitely.
And so my point is that your physician needs to be trained on hormone replacement therapy to make this adjustment to help you with the right formulation.
Yeah. And sometimes they just don't dare to do it. And I hope that in the future more will be trained so that it's really not so scary. And really nothing can go wrong. There's no much risk to take. The benefits definitely outweigh the risks, for sure.
Yeah. But a good point is that when you go to your physician to really check if they were trained on hormone replacement therapy, and also if they've been trained on menopause, because these are the people who can really help. Yeah. So one more question from me, and that's all women experience, unless, just give me a second, I want to open the chat and see, there are quite a few questions that came up. I think it's kind of a very, it's a topic that everyone really is very interested to know.
So when you get HRT during perimenopause, does that mean that you're better protected against the dementia? So kind of like cause and effect. You speak to that a little bit.
It does look like it's actually protecting you. Again, also on this, more research is needed if you really want to say, yes, it definitely is, but there is already research showing that it is protecting you against dementia. Yes.
Beautiful. So I hope that answers your question, Marianne. Thank you, Natalie. We have another question for Jana. And this is similar to the question I was about to ask you. At what age is it recommended to consider starting hormone therapy, especially if you're looking at like in between those years of like perimenopause and maybe just after pregnancy? I learned also recently that it could start as young as 35. So that's like in between the years where many women still have pregnancies. How do we deal with that? What would you say? So the first question is, what age is recommended to consider starting it? And how do you look at that phase in between?
Yeah, I think that's a very good question. And there's also not one answer to that. And there's not a certain age where you should start perimenopause. I think it's indeed different for everyone. Perimenopause can take the mean age of menopause is 51 years old. And we now know that perimenopause can last 7 to 10 years. So, take that back, and the 51 is an average. So you can be in menopause years before that or years after that. So yes, indeed, it can start at 35. Yeah, indeed, these are also still ages where you want to get pregnant, or where you just were pregnant and your hormones are still a bit off. So you can't really tell, is this perimenopause? Is this still postpartum? What is going on? In that case, maybe I would recommend give it some time to see what's going on. So to see what's if it levels out, if it goes away, these hormonal changes. But at the other hand, you could also just say, again, also the quality of life is also very important. And when you're at a young age, once you're starting having symptoms, it is a sign of your body switching and shifting hormones. And it has been proven that when you start on time, that's when you actually get the benefits of HRT. So I would say better sooner than later. And when you do experience the brain fog, the stiffness, the moodiness, or anything that interferes in your life, just give it a try. You can always try it for 3 months, but it's very good to know, obviously, that it's not birth control. This is so still in your reproductive age. If you're, it may actually help you in your reproductive age, but when you do not, when you do not want any more children, then it's not. What you can consider then is, for example, an IUD with progesterone, and then add estrogen on the side. That's possible.
Yeah.
So there's no right age. There's no right answer. It's, again, not a one size fits all. It's just, I think when you get to the age of, let's say, 40, and you feel off and you are being told that maybe you're burnout, I think it's perimenopause until proved differently. So whenever you feel off and you have these symptoms that could look like burnout, because it's really hard to distinguish between these two, but when you're in that age, please consider perimenopause first, try HRT. If that doesn't work, then you can always add other things to, maybe if it is burnout, then you have different tricks to deal with that.
Yeah. And we have a comment from Sasha, and it says, for protection of heart and blood vessels, there was a recent study that proved that starting with HRT when you're 45-year-old protects your blood vessels and heart. But I think it depends on how your body ages. A lot of times symptoms are not recognized when you're 40, 45.
That's very true. Yeah.
Yeah.
That's very true.
And that also brings me to another question. And because there are almost over 100 symptoms, that it's not just sleeplessness, it's not just hot flashes. There are a lot more, and we all experience those symptoms differently. And actually, some of us don't experience any symptoms.
Yeah.
And so my question is why is it different for every woman? And some experience intense symptoms, some don't experience symptoms. What determines the range of our experience?
Also, great question, but not just a simple answer. I don't think we really know why one experiences a lot of symptoms and the other none. It has been said that, for example, when you've experienced trauma, for example, in your first when you were very young, that can have an effect on how you also experience perimenopause. It's really a time of transition in the end, right? So sometimes you also see that whatever was in your system, in your body, and you carry that for a very, very long time. This is just one thought, right? But when you've carried it for a long time and you've been able to suppress all your feelings and all your, well, the trauma in your body, you're no longer able to suppress that in perimenopause. And sometimes it just comes out at that time, and it still needs a way to get out, and I think in many other countries, there's more attention for that, and other reasons why it can be genetics. There's a lot of research on genetics. For example, there is a gene called COMT, so COMT. When no, I don't remember, low or high. When you have that, you're prone for that gene, then you don't break off estrogen very well, for example. That can be an effect, or genes in. But yeah, I think that also there is a lot of research still going on the genes. And also I think the purity is a very good sign, or not a sign, but a very good indicator. Thank you. Sometimes my word was finding a very good indicator of how you also respond to perimenopause. But why the one person has no symptoms and the other one has a lot, it's still, I think, a big question. Maybe it's genetics, maybe it's what you've experienced in life. It can be a lifestyle, obviously, is a very big factor, and that's definitely the one where you have most influence on. I mean, if you eat a lot of sugar, it really gives symptoms a lot. So sugar, if you don't sleep, you will get more symptoms. If you do work that you don't like, for example, so that's a very important one. So this is a great phase to really get back to the baseline of who you are, reset all the buttons again to whatever works best for your body. Alcohol, of course, doesn't help. Smoking doesn't help, not only for menopause, for nothing really. Yeah, so these are really the lifestyle factors that definitely have influence on how you go through menopause. Yeah.
Yeah, and these are really great answers. And also from what I know from my own experience, and I was reading that, for example, if you had insomnia before perimenopause, and then you will have most likely even more symptoms of insomnia during, and the same headache. So something just to look for.
Yeah, definitely. That's definitely true. Yeah, it just gets worse. If you're already prone to it, it just gets a little worse.
Yeah,
everything gets worse. Yeah, I think this was also a very good time for me to see what I could do in my own life to influence how I felt. I think cutting back on sugar was a great thing. I had no idea I was eating so much sugar, for example, and now I replaced it for at least 500 grams of, well, not every day, but I try to eat 500 grams of vegetables every day. Yeah. Mm-hmm. So that's a big change. And so when I'm hungry now, I know that when I have these, at 4:00 in the afternoon, you are a bit hungry. I am, at least. Now I do not reach for a cookie. I reach for some, cucumber, whatever. I just always make sure I have enough vegetables on me. And this actually is also proven that it makes you feel better. The 500 grams of vegetables.
That's regardless, right, Natalie, whether we're in perimenopause or not. Because I remember in a talk we had with a dietitian before, that our insulin levels impact our hormones, estrogen and progesterone, even before that, and how much energy we have.
Yes.
And how much fat we hold or potentially hold. Yeah.
You can feel it as well, right?
Absolutely. And I have another question. And that's based on, currently we are doing research on behalf of Institute FLEI, where we're asking women about their symptoms. And one of the things that we are discovering that women struggle with is the way that they handle stress and their mood. You spoke about it in the beginning a little bit, where you mentioned okay, it could be that perimenopause is confused with burnout, but it seems that stress does have an impact on how severe the symptoms are. Can you talk a little bit more about how you use that intersection of nervous system regulation to help women in this transition? Why is that important that we not only look at things like HRT, for example?
Yes, I think that's a very good mention, because HRT is one thing, but if you do not look at all the other things around it, it's not gonna, it's not, it's again, also HRT is not a magic pill. So I think it's a great thing to mention, and especially your nervous system, because I think your body is just in stress, right? In this phase of your life, which also already means that your cortisol is a lot higher in this phase of your life than any other period of your life. So I think, and what it actually does when the cortisol is higher, there is something called the progesterone steal. So when your cortisol is higher, it actually steals your progesterone, which is already low, and it is even lower because your body, of course, it gives it wants to help the stress first before it makes you feel zen, right? So you need to cover the stress first, and then you can chill after. So it takes your progesterone. It's on the same cascade. But I think what my way to go is really the heart coherence, which I've learned through the Heart Math Institute. I don't know if people are familiar with that, but it's really my way to go. And I always teach the women as well to influence your nervous system by breathing and lowering your heart rate variability. So when you're in stress, how should I explain? Yeah. So when you're stressed, your heart rate, your HRV, is everyone familiar with HRV? It also is a bit incoherent, right? And you can just feel in your body that it doesn't feel nice. And through heart coherence, you can actually use breathing technique to change your physiology and make your HRV coherent again, which you can also really feel in your body. It makes you feel relaxed. So I think if you train that, for example, 3 times a day, which already sounds like a lot, but even 5 minutes can be enough, just breathing in and out of your heart. It might sound a bit strange, but it just gives you a little time to reflect and sit down and get control of not only your breath, but your whole body will thank you really for taking a moment. That's the point where you have your sympathetic nervous system and your parasympathetic nervous system, which is your on and off the parts of your nervous system. So when you start doing those nervous system regulation practices, then the parasympathetic nervous system is more activated than the other one, because I think especially in this phase, the sympathetic nervous system is a lot more active than the other one. And I think the heart coherence practices make you feel more in balance. And it's super easy. I think the impact of it is major, and it's so easy to do. I think you can find on YouTube some easy exercises to do so, demonstrations. Yeah.
I'll make sure that I already put it in the chat. I'll make sure for those who are maybe looking it up that we will send out an email with all of the resources that have been mentioned. So thank you, Nathalie, for that very simple strategy and using the power of our breath to regulate. I'm very aware of time. We have a couple of minutes left. If you have any questions for Nathalie, please write them out. We can always answer them later or through our email. Do you want to ask the last question, or should we start rounding up?
Just one quick question, because a lot of times we're talking about self-care, but sometimes it's hard to know what's really self-care that we need. And so maybe you have any words about that.
Yeah, it can be anything, right? But not only the heart coherence will help you settle in your body and feel more relaxed and get new control of your whole system. It actually also connects you to your heart, because sometimes we don't know, right, what we need. It can actually give you a lot of stress thinking of, gosh, I need a hobby. I don't know. I don't have a hobby. What shall I do? I don't know what to do. That gives you stress again. But I think I really use the heart as a key for everything, really. So the heart coherence can be a great tool as well to, when you feel uncomfortable in your body and you don't know what to do, and you don't even know what self-care is, I think the first thing that you can do is sit and be aware of that. Let it be. Notice maybe what you're feeling. Maybe you don't need to even ask your heart, but connect to your heart, and to really believe it will tell you what you need. And it can be anything. It can be really anything. If you want to sit on the couch, watch Netflix, or you just want to go for a walk. But I think anything but not laundry or household. Generally, these are not really just for you, right?
I always say whatever brings you joy.
Whatever brings you joy, I think it can be anything, really.
Yeah. Yeah, that puts you in a flow, that whatever it can be. And sometimes people say meditation, but it's not for everyone. Sometimes your meditation can be, watering your flowers, and that puts you in the flow.
I think just whatever comes up when you have that little time of breathing in and out of your heart, whatever comes up, just do that for a little bit. That's it. That's all you need. It can be very simple.
Yeah. Thank you so much, Natalie. We're going to take maybe one or two last questions, and we're almost at the top of the hour. And I think everyone is kind of digesting the information, so which is fine. So
it was a lot, wasn't it?
We could have done a series out of this.
Sorry. Yeah, there was a lot of information. I hope you followed. Yeah. I hope it was okay.
If some of the questions come up later, please email to us and we'll ask Natalie, and we'll send the answers back. And with that, we want to close up this session. Natalie, thank you so much. It was so informative. And it's one of these transition periods in female life when we don't have enough information. And it's so important for us to be in this type of forum, to listen from somebody who really knows with real expertise, to make sense of our experiences. So
thank you.
Thank you so much.